Imagine this. You wake up one morning, throbbing headache, sore throat, fever, terrible cough. You decide you need to see your doctor, so you give their office a call. Yes, we can see you. Not till next week. Frustrating, isn't it? Only if your doctor's office employed more nurse practitioners. Today I'm going to be talking to you a little bit more about what a nurse practitioner is, the education that is required, and the advantages to developing a relationship with a nurse practitioner. You may think that nurse practitioners are new to the healthcare setting, but they're not. According to the Slippery Rock University website, the first nurse practitioner was educated in 1965 in Colorado. The purpose of educating these pediatric nurses was to send them out into the rural healthcare areas to help with children of need. They quickly realized that sending nurse practitioners to the rural areas were more cost effective, and also these nurses had very good experience and knew a lot about what they were doing. These first contact healthcare providers then became branched out into many different areas. There are many different specialties now of nurse practitioners, including geriatric, psychiatric, acute care, family, and community and public health, just to name a few. In fact, there are now more than 50,000 nurse practitioners in the United States today. So what does a nurse practitioner actually do for you? According to careerplanner.com, it states that the job description of a nurse practitioner is that of a general medical provider that can provide you with an assessment and treatment of your daily healthcare needs, just as in different healthcare settings as well. Doctor's offices, hospitals, specialty clinics, and various different outreach clinics also. Nurse practitioner will also have the ability to write prescriptions, order labs, and x-rays. So how does this differ from a doctor? Generally, a nurse practitioner works very close with a doctor. The doctor kind of oversees what the nurse practitioner is doing and oftentimes makes suggestions and refers the patients on to other doctors if they feel like they are sick enough. The educational requirements of a nurse practitioner is to receive your Master's of Science in Nursing, followed by a minimum of at least 500 hours of clinical experience. According to the American Association of Nurse Practitioners, there is current research being done that this 500 hours of clinical experience maybe just isn't enough. The scope of practice for nurse practitioners has increased, so why shouldn't the clinical requirements increase as well? The more specialized your degree of nurse practitioner, the more increased hours are required. There are certain advantages to become a nurse practitioner. There's increased wages. The average wage for a nurse practitioner in the United States is $81,000. This number quickly increases as you become more specialized in your field. There's also advantages such as having office hours, meaning no weekends and no holidays, and also the overall ability to help people become more healthy and hopefully prevent further illness and sicknesses. What is the advantage of developing a relationship with a nurse practitioner versus a doctor? Just as I had said at the beginning of my speech, you can get in generally to see a nurse practitioner quicker. They tend to keep more openings available for short-term problems like sinus infections, ear infections, things like that. It's also more cost-effective. If you don't have insurance, it's less expensive to see a nurse practitioner versus an MD. They are quickly on the rise, and more clinics, hospitals, and specialists are turning to these advanced practice nurses to help with the treatment of their patients. Nurse practitioners are also satisfied with their job. In a survey of 100 nurse practitioners in Maryland, it showed that over 58% of those interviewed were highly satisfied with their job as a nurse practitioner versus a regular floor nurse. This is according to an article written by Don Waldersweet and Company. It's a new day in healthcare. Nurse practitioners are growing quickly. In an article found on collegeboard.com, government economists predict that nurse practitioner jobs are growing faster than any other job out there. And why is this? This is fueled because the emphasis on preventative health care, thank goodness, and the growing number of elderly people out there. Let's face it, the baby boomers, they are growing. I hope today I have given you a better understanding of what a nurse practitioner is so that someday when you call your doctor's office and they offer you to see a nurse practitioner versus your own doctor, you're more aware of what they do, the education that they have received, and you are more comfortable seeing them. And who knows, maybe in the next 4 years, you might be seeing me.